now that you've seen proper impression taking techniques and how to properly use the impression, I want to sit down with you for a moment and show you some of the common errors that we see in the laboratory that would cause issues or phone calls to the doctor's office to say we need a new impression or we may be dealing with a compromised situation here. The first one I want to show is a super common problem in crown and bridge where the light body did not properly capture the entire margin of it. So if you refer to this model or this impression here, you can see down near the distal of this molar that the light body has actually flowed into the hard body and separated away from the margin. What this is going to cause is a distortion in the model, and it's going to cause an inaccurate representation of where that margin is. Likely what will happen is if we do not get a new impression, we're going to have an ill-fitting crown or a rocking bridge or something of the sort there. When we take our models and we are finished pouring our model, you can see where the distortion is. This is not going to be acceptable for a crown and bridge restoration. We will need a new impression for this, or there will be some heavy adjustments chairside in order to get this fit, and may even need some composite to fill an open margin or something along the sorts. Either way, it's going to be a compromised restoration and not the best thing for your patient. Another very common problem that we have with these impressions is distortion. This distortion happened here, near the anterior region. This is an anterior region that's going to oppose another part of the restoration. So we're going to be making crowns that are opposing this, and we have an issue here where it looks like either the tray was moved in the mouth by the assistant or the patient let go and kind of rebit down during the impression taking technique. And that actually caused a double impression or a distortion in the impression. So when I pour the model, you can see along the incisal edge right here where the distortion is and where the teeth have actually protruded out farther than where they actually may be. The funny thing about these impressions are they're actually for the same case. So if I take these two models and put them together, you're going to see that I don't have proper occlusion in the anterior where I need to make those restorations. This is going to result in heavy adjustments chairside or a complete failure of the product. As you know, everything starts with the foundation of the case. And without giving us the proper impressions and the proper clarity on where our devices need to fit to, we really don't have much of a chance of getting it to fit right. This causes complications and frustrations for both the practice, the patient, and the laboratory. Remakes aren't profitable for anybody, and that's what we're here to try to reduce and eliminate today. So thank you for watching, and please have a great day.